Today we'll study about the cervical vertebra. The cervical vertebra, they are 7 in number. And the special characteristic where you can identify the cervical vertebra is that you have the foramen transversarium in the transverse process of the cervical vertebra. You can find the foramen transversarium in the transverse process of the cervical vertebra. So in this foramen, you can see there's a running of this vertebral artery. Right and left vertebral artery in the foramen transversarium. Out of these 7 cervical vertebra, the third, fourth, fifth, and sixth cervical vertebra has common characteristics. That's why they are known as typical cervical vertebra, whereas first, second, and the seventh has special feature. That's why they are known as atypical cervical vertebra. So let's study about the first cervical vertebra, that is the C1. So this is the first cervical vertebra, where you can see the vertebral body, this one anteriorly, and the vertebral arch posteriorly. This is the spinal cord running in between the vertebral foramen. So we'll study this in this specimen. In the C1 vertebra, this is ring sepate. You can see it's a ring sepate, where you can find anterior arch, posterior arch, and the 2 lateral masses. So this is the right lateral mass and the left lateral mass. In the anterior arch, which is short, there is a tubercle. So this is the anterior tubercle present there. Whereas the posterior arch, it is long. And you can find there is also a posterior tubercle present behind the posterior arch. The anterior arch is marked by a median anterior tubercle on its anterior surface. And the posterior surface, there is an oval facet. So you can see there is an oval facet on the posterior surface of the anterior arch. This is it. This oval facet, it articulates with the dens of the C2 vertebra. The upper margin of this anterior arch is connected to the foramen magnum. This is the foramen magnum. It's connected to the upper margin of the foramen magnum by a anterior atlanto-occipital membrane. So this is the occiput and this is the atlas. So there is an anterior atlanto-occipital membrane in this gap. So in this gap, there is an anterior atlanto-occipital membrane. The posterior arch is longer than the anterior arch. In this posterior arch, you can find there is a groove. This groove is for the lodgement of the vertebral artery and the first part of cervical nerve. The upper surface of the posterior arch is connected to the upper margin of the foramen magnum by a posterior atlanto-occipital membrane. So you can see in this skull is the gap that is covered by posterior atlanto-occipital membrane. The lateral masses are weight-bearing and presents the upper, this is the upper articular facet and the lower articular facet. The upper facet is kidney sepate and deeply concave. It is articulating with the condyles of the occiput. That is, you can see this occipital condyles. It articulates with this upper surface of the C1 vertebra. The medial surface of the lateral mass, it gives attachment to the transverse ligament of the atlas, which passes behind this odontoid process. So here you can see the odontoid process. Just behind it, there is a passage of this transverse ligament of the atlas. And it helps to retain the odontoid process in its place. The transverse process projects laterally from the lateral masses and is usually long. It is very long and can be felt on the surface of the skin between the angle of mandible and the masseter process. So this transverse process can be palpated. The second cervical vertebra, this vertebra has a special 3 features. That is, it has an odontoid process. So this is the odontoid process, weight-bearing superior articular facet, and a massive bifid spine. So this is a bifid spine. You can see the spinous process is bifid. This odontoid process, it projects upwards from the body of the C2 vertebra, and it represents the centrum of the atlas. That is, the body of the C1 vertebra has merged with the body of the C2 vertebra. The dens, it articulates with the anteriorly with the anterior arch of atlas. So this is the one that articulates with the anterior arch of this atlas. Anteriorly and posteriorly, it articulates with the transverse ligament of the atlas vertebra. And there is a presence of the bursa in between this dens. The dens is connected to the base of the skull by ligaments. The tip of the dens is connected to the anterior margin of this foramen magnum by a apical ligament of dens, which is the remnant of the notochord. So the ligament that is coming out from the tip, this is the remnant of the notochord that is present in our adult. A pair of alar ligament diverges from the dens and are attached to the lateral margin of this foramen magnum. So in this lateral margin, there is attachment of the alar ligament, right and the left alar ligament that is coming out from this lateral area of the dens. The superior articular facets are weight-bearing and it overhangs this foramen transversarium. It is the large and flat and circular, which is directed upwards. It articulates with the inferior facet of the atlas vertebra to form atlantoaxial joint. So this one, it articulates with this inferior facet of the C1 vertebra. This is the anterior, posterior, so this is the inferior facet to form the atlantoaxial joint. This inferior articular facet of the C2 vertebra lies posterior to this transverse process, and it articulates with the C3, superior facet of the C3 vertebra. Pedicle of the C2 vertebra, they are short and they are coming backward from the body of this dens, and the lamina are thick and strong. They are directed backwards and medially from the pedicles. And then you can find there is a small spinous process which is bifid that is coming posterior medially from the lamina. The last atypical vertebra is the C7 vertebra. So in this C7 vertebra, the unique feature is that the spinous process, it is not bifid and it ends in the large posterior tubercle. This tubercle can be felt in the back of the neck. When you flex the neck, there is a vertebral protuberance. Or when you flex the neck, we can palpate the spinous process of C7 vertebra. So in this picture, you can see there is the vertebral protuberance when the neck is flexed. The transverse process of the C7 cervical vertebra, it also has foramen transversarium. But sometimes it may be absent, sometimes it might be double, but it does not passes this vertebral artery. The vertebral artery, it runs in front of this foramen transversarium. You can see in this specimen too. But from this foramen, there is a transmission of the accessory vertebral veins and nerve plexuses. This anterior root of the transverse process may sometimes develop to form the cervical ribs. So if these cervical ribs are formed, that is deformity if it is present, it may produce the compression of this artery, the subclavian artery, and then it might give the symptom of thoracic outlet syndrome. And there may be compression of this brachial plexus of the nerves too if there is the cervical ribs present there. So usually the cervical rib, it arises from this C7 cervical vertebra. Now the typical cervical vertebra, we studied the atypical, that is C1, C2 and C7. Now the rest, C3, C4, C5 and C6, they are typical cervical vertebra because they bear the common characteristic feature. So this is a plastic specimen of the typical cervical vertebra, where in the vertebral bodies, you don't find any this notch. So this is made in order to hang the vertebrae. So ignore this. Okay. So what you can find is that the body of the typical cervical vertebra, they are transversely oval and they are small. The upper surface of the body, there is a presence of this raised lips or the uncal process. Okay. So these are the uncal process that you find typically in the body of the cervical vertebrae. The body articulates with the adjacent vertebra are connected by the secondary cartilaginous joint. So these two vertebrae are joined by the secondary cartilaginous joint. This secondary cartilaginous joint has nucleus pulposus in the middle and annulus fibrosus on the peripheral part. A pair of synovial oncovertebral joint, that is from here, oncovertebral joint is formed in the body of the cervical vertebra. So right and the left, total number of 10 oncovertebral joints are present. So this is the oncovertebral joint, which is a plain type of synovial joint in the body of the vertebra, cervical vertebra. You don't find these oncovertebral joint in other thoracic or lumbar vertebra. So only it is a special feature of this cervical vertebra. This vertebral foramen, it is large and triangular for the accommodation of the cervical enlargement of the spinal cord. The pedicles arises from the posterior lateral part of the body. So this is the vertebral body. Now there is the neural arch or the vertebral arch. So this pedicles, it arises from the posterior lateral part of the body, so that the superior and inferior vertebral notches, superior vertebral notch and the inferior vertebral notch, they are of equal size. These lamina are thick and directed backwards and medially from this pedicle. So you can see from this pedicle, the lamina are directed backwards and medially, which joins with each other to form the spine of the vertebral. So in the vertebral arch, you can find the spine of vertebra. The spinous process is short and it is bifid. You can see there is a two processes coming from the spinous process, and this bifid structure, it gives supports to the ligamentum nuchae that is present in the, especially in the all cervical vertebrae. So there is a support of the ligamentum nuchae. The superior articular process and the inferior articular process, it projects from the junction of the pedicles and the lamina. So the superior articular process, it projects upwards, whereas inferior articular process, it projects downwards. The superior articular facets are small and flat and faces backward. So it is facing backward. Whereas the inferior articular facet is also small, flat, but it's directed forward. So you can see the direction of the inferior articular facet forward and downward, whereas superior articular facet is directing upwards and backward. So this superior and inferior articular facet, they form the facet joint. So this joint is also known as zygapophyseal joint, and they are the plain synovial joint that permits the flexion, extension, and the lateral rotation. The transverse process is directed laterally. It is pierced by the foramen transversarium, from where the second part of vertebral artery, it is passing upwards through this foramen transversarium. So in this foramen, you can see there is a passage of this second part of vertebral artery, and there is also plexus of the sympathetic nerve plexus, and also the veins, vertebral veins are also accompanying this artery. We talked about typical and atypical cervical vertebra. Now we'll talk about the craniovertebral joints. So we have the craniovertebral joints are atlanto-occipital joint and atlanto-axial joint. So first we'll study about the atlanto-axial joint. They are the pair of, so this is the anatomical position. They are the pair of ellipsoid joint that is formed between the superior articular facet of the lateral mass of C1 vertebra with this occipital condyle of the skull. So this is forming the ellipsoid joint. And this joint is the joint of X, where you can see the skull has flexion, extension, and mild degree of lateral rotation. So this is possible within the C1 and the skull, which is called as atlanto-occipital joint. The strong ligaments of this C1 and occiput joint is the anterior atlanto-occipital membrane, posterior atlanto-occipital membrane, and in between the joint there is a fibrous capsule covered by the synovial membrane inside the fibrous capsule. Now the second joint is the atlanto-axial joint. This joint is between the inferior facet of this atlas vertebra, C1 vertebra, and the superior facet of this C2 vertebra. And this is a plain synovial joint. That is the two-plane synovial joint in this C1 and C2. And a one median atlanto-axial joint between the dents of the axis and the anterior arch of the atlas and the transverse ligament posteriorly. So this is the pivot type of synovial joint. That is the median atlanto-axial joint. So what you can see is that in this pivot, there is the rotatory movement of the C1 vertebra on this axis. That is the C2 vertebra. This is the pivot type of synovial joint. So this joint, it produces the movement of no. So this is the joint of no, where there is right lateral flexion and the left lateral flexion.